Good morning, folks. It's Diamond with the Oppenheimer Ranch Project and Magnetic Reversal News, bringing you a coronavirus outbreak update Wednesday, March 11th at noon 2020. Now is not the time to panic. Keep calm and wash your hands. Period. At the current outlook, the official numbers, coronavirus cases at 122,005 worldwide, 4,390 deaths, 66,000 recovered, a little over half. But these numbers are not correct. The number of cases is definitely double or higher. And the deaths, well, it's anyone's guess what that actually is, because the majority of those deaths are coming from the numbers from communist China. Now, Schumer and other senators asked Trump to issue a national emergency declaration for coronavirus. Now, this may be good to protect the financial markets and the resources of humanity, but it's not going to protect people. And we'll get to that in a minute. As the world runs around like a chicken with its head cut off, Beijing is going to quarantine all international arrivals as coronavirus cases rise. And the list goes on. Italy is in a coronavirus lockdown, the entire country, 60 million, as deaths soar and the economy fades. Shops and restaurants are closed. Hundreds of flights are canceled. Streets are emptied across Italy yesterday on the first day of an unprecedented nationwide lockdown imposed to slow Europe's worst outbreak of the coronavirus. Now, one thing we should glean from this is this. The lockdown imposed to slow the outbreak. There is no way to contain a coronavirus. It's the cold. We've never been able to contain the cold, ever. And what makes anyone believe they can contain this virus, it just means that they're uneducated and then they didn't do any research into the topic. Now, what a lockdown will do, what quarantines will do, is absolutely slow the spread and prevent the infrastructure in the medical industry from breaking down. And that's what they're trying to do. There is no way to contain this virus, no matter what anyone says. It's a cold, and it spreads. It has a very high R naught, in other words. Now, New York Governor Cuomo questions the low rate of coronavirus testing in the U.S., and that's for good measure. This is the reason this was going on, is to prevent panic. But the panic is already occurring. So what's going to happen is once we start testing a lot of people, the numbers are going to rapidly rise and people are going to panic. As Angela Merkel in Germany warns that 70% of Germans will be infected. When you make a statement like that, people are going to panic, especially uneducated people. They don't realize that 99.999% of them will not require hospitalization because they've all had the cold. They've all had a flu. They've all had a virus of some kind, most people. And so 70% of people getting a cold is not a reason to panic, period. If you're not at risk, this is not a risk for you. And then the CDC today coming out saying, take this seriously. Coronavirus is about to change your life for a while. And that's because the powers that be are changing your life, not because of a cold that if you get, nothing will happen to you. And the official numbers here coming from Johns Hopkins showing the U.S. at 1,050 cases, almost doubling in a day. And that number will continue to double or triple day after day, driving the panic. Real quick, I'm going to leave you a link to Yale's New Haven Health website here, where they go over the difference between coronavirus and influenza. Now, there are many respected, smart people doing videos on YouTube and other platforms that are calling COVID-19 the flu. As soon as you do that, you eliminate all credibility because the coronavirus is not the flu virus. Influenza is a different virus than coronavirus, period. This particular COVID-19 has the same symptoms as many influenzas, but it's still a coronavirus. And so the number is still the same here. We have over 10,000 in Italy. Iran is approaching 10,000. Korea, 77.55. Spain, France, and Germany, those numbers are all going up by several hundred or more per day. This is a cold, which is uncontainable, which is why the map looks like this. It has now spread to 118 countries in just a few weeks. It may have already been there before the testing was in place, which it means that these confirmed numbers are exceptionally low. And as they come in, these red dots are just going to grow, driving that panic. But we need not panic. Be prepared. Don't be scared. This virus will kill many people, but the people that are at risk are old and are sick already. And they would probably die from a flu, let alone the COVID-19. Now, the first case of coronavirus confirmed in Michigan, heads up top knot, Whitmer declares state of emergency. One case, state of emergency. Do you think that's overreacting? Do you remember the swine flu? President Obama did not call state of emergency until 1,000 deaths had occurred in the U.S. And we have a state of emergency at 1 death. Coronavirus cases rise in Washington state, prompting new rules for nursing homes. If you do the math, it gets very disturbing. Yes, because the people in the nursing homes, first of all, the nursing homes are understaffed and they're undertrained. Most of the staff is getting minimum wage, and they are not prepared to fight a deadly virus amongst a population of elderly and infirmed, which is why there's a very high death rate in old age homes, if I can call it that. Is that politically correct? So that's what we're seeing there, and the media is using this to push the fear onto you. And there's the fear live. The Dow now down 1,000. Let's see that, down 930. And all of the markets straight across the board are down live as the economy tanks. NASDAQ, the S&P, the Dow, all down 2 to 3%. The volatility index at 6%. And so this is all being driven by fear. Harvard is giving students 5 days to evacuate the dorms over coronavirus fears. Not realities, coronavirus fears. This kid is not at risk. These students are not at risk. They're at risk of just as at risk of catching the cold or the flu, and they don't shut down Harvard. It's insane what's going on. Philadelphia canceled the St. Patrick's Day parade after the city confirmed 1 case. This is a loss of tens of millions of dollars because of 1 cold. That's where we're at. Do not believe the hype. And yet, we're going to live through weeks, if not months, of closings. LeetCon has been canceled. Everything has been canceled. Starting now, all the way through May. Pearl Jam concert canceled April 2nd. LeetCon canceled April 4th. Ben & Jerry's Free Cone Day canceled. Cybersecurity Symposium canceled. Keystone Symposia canceled. This is into mid-June. So the effects of the financial markets that we're seeing now will continue until mid-June. That is 3 more months. And then there's the supply chain issue. Will food run out? We already know that Purell and toilet paper is gone. But what about prescriptions? There are 30 drugs in short supply in the U.S. right now, and it's only going to get worse. Now, many people are able to buy their prescriptions 3 months in ahead by paying out of pocket, but many people can't do that. And these are the list of the drugs. I will leave you the links of drugs, current and resolved drug shortages. And right on the top of that list is ADHD medication, currently in shortage, amphetamine aspartame, amphetamine sulfate. That's Adderall, folks. Be prepared. Don't be scared. They're hyping this. If you have good immunity, if you've done all the preparation, you have food stores and supplies, you don't need to go mingle with the public if you're sick or older. You're putting yourself at risk. If you're healthy, what you want to do is not give this cold to people that may die. So distance yourself from your elderly, your loved ones, people that are already sick and infirmed, and make the correct decision. You don't need Purell. to wash the virus off your hands. You just need to vigorously wash your hands for 20 seconds. Sing 2 happy birthdays, and the virus will be gone from your hands. Stop biting your nails, touching your face, and stay away from sick and old people. Many people who are carrying this virus don't even have symptoms, which is why we shouldn't panic. And you as a citizen are now responsible for protecting those at risk. This is a call to arms to all humans. Self-quarantine yourself from those that are at risk of dying from this. It's a very small percentage of the population. Those people that are over 70 with pre-existing conditions, especially respiratory. It would be prudent that you stay away for a few months. This disease is a pandemic that will spread worldwide. It already has. The numbers are proving this. You cannot contain the cold or the flu, which is why we do not quarantine cities during cold and flu season. But we're doing it now, and the economy is tanking. It's anyone's guess how this unfolds, but these numbers are going to continue to go up for months. We love each and every one of you. Be prepared. Don't be scared. And wash your hands. And stay away from the sick. It's your responsibility. Be safe.